I'm Dr. Laurie McCauley from Optimum Pet Vitality, and today I want to talk to you about arthritis. What is it? What's going on in the body? And why? So we're actually going to start by looking at a bone. You say, what? Hold on. This is exciting. So imagine if we took this bone, and this is just a femur, and I broke it. What's going to happen in the body? The body's going to say, oh, there's moving parts. There's instability. We need to fix it. And it's going to put inflammation around where the break is. It's going to put scar tissue. And then it's going to say, that's not stable enough. So it's going to put calcium in there, and that's going to create bone tissue. And then the body's going to say, oh, but it's not strong enough, and it's going to remodel it until we have nice smooth bone again. All right? So now let's take that information and put it in our picture of a joint. So if you look here, you can see here's healthy bone. We have the bone marrow, the bone, the joint the joint fluid, the joint capsule, more bone, more bone marrow. So this is our joint. You can also see ligaments here. Ligaments hold bone to bone. It helps stabilize. So now we say, what's going on? Well, if there's any inflammation or even before that instability, something has happened, maybe trauma, anything that can cause inflammation, this is what starts to happen. The body says, oh no, there's a problem. We create inflammation. That joint fluid, instead of being nice and thick, becomes thinner. That means we can have a little bit of touching or grinding of the cartilage, which creates more inflammation. The joint capsule gets thickened. It's inflamed. And so it creates more inflammation. And we have decreased stability. So the body says, there's more inflammation and we need to fix it. So what does it do? It puts scar tissue around the joint capsule or in the joint capsule. And then it says it's still not stable enough. So it puts calcium in it, just like in our bone. And it says, we're trying to stabilize this. There's a problem here. And then we see this calcium building up. And when we take an x-ray, we say, look, there's a bone spur or arthritis. And it all started from the inflammation in the joint. So by the time we see it as thickened or changes in the x-ray, we've had all kinds of changes. So as someone who's a veterinarian who cares a whole lot about this kind of process, our idea is to try to help keep the joint as healthy as possible so we don't even get there. And there's lots of things we can do. We can strengthen around, so the muscles, tendons, and ligaments that help support the joint. Optimum Pet Vitality has a class. Optimum Pet Vitality has a class. It's called Core and More. It's exercises, and it's all the exercises you need for your dog to help keep the muscles and tendons and ligaments strong. We also have a course called At-Home Laser Therapy. So if you have a laser or you're thinking about getting a laser decreases the inflammation. But that's a whole nother talk. All right, I'm Dr. Laurie McCauley with Optimum Pet Vitality. I hope you had fun. I hope you understand arthritis better. And hopefully together we can stop this and keep our dogs nice and healthy. Have a great day.